some women too complain about when they have sex with their partners, the sperms just come out. Whatever it is, what is that about?
So as I already said a few minutes ago, you can't see the sperms with your eyes. So you can't say the sperm is coming out. All right. The sperms just need a medium to swim in, which is the semen.
The semen.
All right. And semen is fluid. Do you get it? And fluid cannot suspend.
Oh, so
so
it's not a problem.
Yeah. So of course, if fluid enters your vagina and you are standing or you are walking or you are sitting, you don't expect it to still be moving up or going up. The important things are the sperms, and that is why they swim. All right, they swim very, very fast.
Yes.
So this is the vagina.
Okay.
All right, so the man deposits the semen in the vagina.
Okay.
All right, as soon as the man deposits the semen, the sperms swim. They enter the cervix. Some hide inside the cervix place called crypt, and then they slowly swim into the womb and then into the tubes. Of course, the fluid will come out. But most women, they'll just tell you that, doctor, the sperms are coming out. The sperms are coming out. That is not a problem. All right.
Okay.
It's just the fluid which is coming out. The sperms have already swum and gone to where they are supposed to go.
Okay. So, ladies, have you heard this thing? Please, those who are asking me to ask this question, I've asked though. Yes. The semen, no. The sperms is gone. And then whatever is left is surplus. So don't worry. And a lot of women go through severe menstrual pain. And I want to ask, does it mean that can lead to infertility, or is just menstrual pain? It has nothing to do with infertility.
Tales and Virtues Podcast. Tales and Virtues Podcast. Tales and Virtues Podcast.
What's up, everybody? Welcome to Tales and Virtues Podcast with your girl Genevieve. Yes, today we're going to discuss a very important topic, and I'm gonna need every lady, every guy, whoever you know, just let them watch this episode, because I know this episode is gonna benefit somebody you know. All right. So today we're gonna talk about infertility in men and women. Sometimes we think it's just men. Sometimes we think it's just women. No. Today we have a special guest in the house who's gonna help us just, go through things, dive into deep things and understand certain things well. All right. And I can't do this without my special guest in the house, Dr. David Pica, who is the CEO of Pica's Medical Center. Hello, sir. You're welcome.
Thank you very much.
You okay?
Yeah, I'm very fine.
Yes. This man, it was difficult to get his attention, but he's here today to help us dive into things a little bit. Okay, so sir, today you are here to help us understand things about infertility, and I know your page on TikTok is all about that. And today, I wanted you here to just help us understand it well. Okay.
Okay.
Right. Okay, so I'm gonna ask you just a few questions, and then you tell us more about it.
No problem.
All right. Okay, so my first question to you is, what actually causes infertility in women?
Okay, let me first say what infertility actually is.
Yeah.
Infertility is the inability of a couple to get pregnant after 1 year of regular unprotected sex.
Okay.
That is if the woman is below 35 years.
Okay.
After 35 years, the time limit is 6 months. And remember, I also said regular unprotected sex. Okay, so these things have to all come in to make a diagnosis of infertility in a couple.
Okay.
All right, so the causes of infertility in women could be a number of things, because the woman's reproductive cycle starts from her menses, the ability for her to ovulate. All right, so for a woman to be able to get pregnant, she has to be ovulating. Okay, and when a woman ovulates, the egg enters the tube, the fallopian tube.
Okay.
And the sperm has to meet the egg in the fallopian tube for pregnancy to happen.
Okay.
There are times too when the tubes may be blocked due to so many other things, which maybe we'll go into later.
Yes.
So the egg and the sperm are not able to meet. That's tuber blockage. So that the cause could be due to a tuber blockage, or the fact that the woman is not ovulating.
But how would a woman know if they have eggs or not?
Yeah, so the fact that as a woman you are having regular menstruation is a good sign.
So the menstruation, is our eggs now that is coming out as menstruation. Nana.
Yeah, so it's not the egg that is coming out, but
That's what I heard.
it's not the egg that is coming out. It's the lining of the womb, the inside
Okay.
of the womb.
It has nothing to
Because
do with eggs.
it has nothing to do. What is coming out is not the egg.
eggs.
The egg is micro. You can't even see it with your naked eye.
Okay.
The egg is released if it doesn't get fertilized.
Okay.
By the end of the month, the woman would have a menses. She will shed the lining of the womb for everything to reset, for her to have another month of probably getting pregnant.
Oh, okay.
So far as you're having your menses regularly, when we say regular, it means you can predict it. You can say, oh, my menses will come on Thursday, 5th April, and Thursday, 5th April come. Maybe plus or minus 1 or 2 days is allowed.
Okay.
So that is a good sign that you are ovulating.
Okay, so let me ask this. I personally heard that maybe if a woman, have a couple of abortions here and there, it means, you ex so you can't have a child. Maybe if a person have done 1 or 2 abortions, probably let's say 3, does it mean she can never have a kid?
No. The problem.
Or the eggs are plenty.
The abortion has got nothing to do with the eggs, actually.
Oh.
What we want to avoid is doing abortion the wrong way. All right, doing it without a qualified person.
Yeah.
Not seeing the right person, taking things on your own, going to insert things in your vagina. And a lot of ladies do that. Instead of going to the right place to see professionals, they do it on their own.
Yeah.
And it is complicated with infections, all right, where it may affect the tubes, and then the tubes may become damaged or blocked.
Okay.
Or may go to a quack who may overscrape the lining of her womb, which you call the endometrium. And then it gives her a lot of complications. That's the problem that abortion causes, and causes infertility when you do it with the wrong person, do it with a quack, do it on your own because
So
you're
it's
scared
not because
to go to
your
a health
ex is
facility.
done.
No, it's got nothing to do with the eggs
eggs.
at all.
Oh, okay. All right. So now let's come to the men a little bit. Doctor, you and I know very well, most of the times they'll be like, oh, it's the woman. But sometimes it's the men who are not doing. So what is the problem? Why are some men not fertile enough? What is causing infertility in men?
Yeah, so when it comes to the cause of infertility, and that's why we try to educate people a lot, it's not always the woman. In fact, both men and women contribute equally to cases of infertility.
Yeah.
When a couple is not getting pregnant, 30% of the time, the cause could be from the woman, 30% of the time could be from the man. And there are cases that both of them may have a problem. So it's not always the woman, as people always think. And then the men would tell their wives or their partners, you go to the hospital, I don't have a problem. No, we always prefer the man and the woman come to the hospital together.
To check both.
Yeah, so the causes could be that the man has low sperm count, which we call oligospermia.
Okay.
All right, or isospermia, where there's absolutely no sperms at all.
Oh, it can be like that. There will be no sperms at all.
Yeah, and we see
so
it quite
the one
often.
that comes out now, what is that?
So what comes out is semen. Okay, semen is the fluid.
So semen is not sperms.
No. Sperms are in the semen. You can't see the sperms with your naked eyes.
Oh,
You have to see them under the microscope. It's impossible. Just like the egg, you can't see the egg with your naked eye.
So we are saying sperm, but that is not sperm.
No. That is semen.
Semen.
Yeah, so the fact that something is coming out doesn't mean there's sperm in it.
Okay.
So there's some men who are having isospermia, which means there's absolutely no sperm. Some oligo, very, very low. So there's no way it can fertilize a woman. Sometimes there may be problems with the sperms which are even produced. Maybe they are not moving properly. Their morphology is not good. I mean, they don't look very well enough to be able to fertilize a woman. Okay, so these are some of the problems men could have which they would not even know they have. And
They have it.
so that's why it's always important for the man to also visit the
Can I
doctor
ask
with the
this
partner.
important question? Alcohol, can it cause infertility in men? Or
Yeah.
even in women?
Alcohol has a role to play when it comes to infertility, especially when we consume high level of alcohol. All right, it's causes a lot of problem. One, it could affect spermatogenesis, that's the production of sperm by the testes.
Okay.
Do you get it? It can affect it by causing what we call oxidative stress. And it can affect the motility of the sperms which are even produced or how they look as well. All right. Alcohol also reduces testosterone level in men. Testosterone is the hormone in men that increases their libido. And it also helps in the production and maturation of sperms. So alcohol causes reduction of testosterone, which could affect the libido of men.
Okay.
It also affects the liver and the hormones the liver produces, causing an increase in hormones like estrogen, which is the hormone that women rather have predominantly. And this also has a negative effect on testosterone production. So drinking excess levels of alcohol, mostly we say more than 14 units in a week, it's not healthy and it has its negative effects.
Okay. What about these days? There are a lot of men enhancement products, all those things. Is it good for them, or some of them it can cause problems?
So what I would advise is that if you have a problem with erectile dysfunction, which is the reason why most men take these things, make sure, one, you see a healthcare provider to find the cause and prescribe what you really need, and make sure that whenever you are buying anything over the counter, it's approved by FDA before you use it, and not just go and buy anything and then
there are some people almost to me share droby basically 4 days. Yes, or no like that. All those things, it's not good for them. Right?
Make sure whatever you are getting is approved by FDA, or you see a healthcare provider to prescribe what you really need, depending on what he finds and what diagnosis he makes. That's the best thing to do.
Okay, so men, the alcohol, number one, must stay away. All right, so doctor, let me ask you this one. What advice would you give to men, those who can't perform at all, like the performance parts? Yes, a lot of women come into my DM and most of them are having relationship and marriage problems because of performance. What advice would you give to men so that their performance can be?
Yeah, so it's all about when you have a problem with performance, you have to see a healthcare provider to find the cause. It could be due to low testosterone. As I said, testosterone is the hormone that helps men when it comes to libido, getting erection, getting aroused. There may be reasons why your testosterone may be low, depending on so many things. Maybe your stress. Stress alone can cause that. It increases a hormone called cortisol, which also reduces testosterone level. It could be some medications on which you are, such as certain blood pressure medication. All right. That could also have a negative effect when it comes to erection, or antidepressant, those kind of medications. And there are always alternatives to these medications. So maybe you are taking this particular blood pressure medication and you're having a problem with erection and arousal. Most men would just rather stop it so that they are better, but they may be negative. There are always alternatives, which you have to see the doctor. There may also be diseases like hypertension and diabetes, which, when it's not controlled, affects the blood vessels and the nerves that supplies the penis. All right, and when these blood vessels are affected, you would have problems with erection. So sometimes this may be the problem, but because the man is not going to the hospital, he doesn't even know what is causing it, and is buying medications on his own.
And doctor, some women too complain about when they have sex with their partners, the sperms just come out. Whatever it is, what is that about?
So as I already said a few minutes ago, you can't see the sperms with your eyes. So you can't see the sperm is coming out. All right. The sperms just need a medium to swim in, which is the semen.
The semen.
All right. And semen is fluid. Do you get it? And fluid cannot suspend.
Oh, so it's not a problem.
Yeah, so of course, if fluid enters your vagina and you are standing or you are walking or you are sitting, you don't expect it to still be moving up or going up. The important things are the sperms, and that is why they swim. All right, they swim very, very fast. So as soon as the man ejaculates into the vagina, which I could show you.
Yes.
All right, so This is the vagina.
Okay.
All right. So the man deposits the semen in the vagina.
Okay.
All right, which is fluid. So you don't expect that fluid without a pump. I mean, if you are living in a story building and you want water to get up, what do you have to do? You have to pump the water.
Yes.
Of course, there's no pump here to pump anything. The semen is not even supposed to enter the
Over there.
endometrium cavity that's inside
Okay.
there to
Okay.
cause inflammation.
Okay.
What happens is the sperms, as soon as the man deposits the semen, the sperms swim, they enter the cervix, some height inside the cervix place called crypt, and then they slowly swim into the womb and then into the tubes. Of course, the fluid will come out. But most women, they'll just tell you that, doctor, the sperms are coming out, the sperms are coming out. That is not a problem, all right?
Okay.
It's just the fluid which is coming out. The sperms have already swum and gone to where they are supposed to go.
Okay, so ladies, have you heard this thing? Please, those who are asking me to ask this question, I've asked though. Yes, the semen, no, the sperms is gone, and then whatever is left is surplus. So don't worry.
And mostly whenever a lady says, doctor, as soon as I have sex with my partner, the sperms comes out, straight away I know that this woman is dealing with infertility. You know, and so that's why she's taking note of all those things. So after sex, they want to lie down, raise their leg on the wall for 30 minutes, 50 minutes, etc. But women who are getting pregnant will never tell you this, but obviously they're also facing the same problem.
Okay.
You know, they feel that something is coming out after sex.
Okay. All right. Wow, that was well explained. I love it. I love it. All right. So, doctor, let me ask you. A lot of people are very paranoid about the fact that when they go to hospital, the doctor will be like, okay, your fallopian tube is blocked. But then there is one which is still working. Please, can you take us through it? Because most women don't understand. If it's blocked, it's blocked. Like, how is that possible?
Yeah, so when the fallopian, as I said, these are the fallopian tubes. They are very important because that is where the sperm and the egg meet for fertilization to happen. And when there's fertilization, what is formed is an embryo. It stays in the tube for 5 days before it enters into the womb for it to grow. If it gets stuck in the tube for more than 5 days, it doesn't move, it becomes what we call ectopic pregnancy. Okay, so there are things that blocks the tube. The most important ones are infections like STDs like gonorrhea, chlamydia, which a lady may be exposed to having unprotected sex. You know, it can cause inflammation and blocks the tube. Pelvic surgeries, maybe you've had a past pelvic surgeries and you form what we call adhesions. Sometimes things get stuck together and it also blocks the tube. There are other conditions like endometriosis, which can also cause blockage of the tube. Now, when the tubes are blocked, it means the sperms and the egg cannot meet.
Okay.
All right. Sometimes one tube may be blocked and the other one is fine. So at least you have a chance of getting pregnant with that one.
So the one tube, no, actually now it's true. You can have a child.
Oh, yeah. There are a lot of ladies who will tell you that they've had one ectopic pregnancy before. It means that tube was damaged. All right. When you have an ectopic, most of the time that tube, it's taken off. So you have one tube. But yet they go and give birth 2, 3, 4. It depends on if the other tube is also not blocked. Just that most often what is causing one tube to get blocked may have also affected the other one. You know, so it reduces your chances. So if one tube is blocked and the other tube is okay, it's fine, but you're still trying and you're not getting pregnant, then definitely you have to see a gynecologist. Something has to be done. And also when you're above 35 years, you have to be more proactive. Maybe that tube may not be blocked, but it's not functioning well.
So can a woman have a child in her 40s?
Oh, yeah, a woman can have a child in her 40s because so far as a woman is in her 40s, she's still having her menses regularly. It means she's still ovulating. So until menopause, she can have it. But of course, the chances are much lower than a younger woman because in your 40s, as soon as a woman hits 35 and onwards, the quality of her eggs are not so good. They begin to decline very fast. All right, as well as the quantity, but the quality too goes down. So there are other things like the ability for those eggs to fertilize are lower. The rate of miscarriages too is higher as well. So she's not as fertile as a woman below 30 or a younger woman. But it doesn't mean a woman can get pregnant after 40 years.
Okay. So, ladies in your 40s, and that means they 40 now, you don't have to wait 45. That doesn't mean a 50-year woman can have a child.
Yeah, everything is possible. But
Janet
as I
Jackson
said,
had her own at 51.
everything is possible. But of course, when you hit menopause, that's it. But so far as you hit 35 onwards, you don't have to
It's-
relax. You have to be proactive in trying to get pregnant because your egg reserve, your ovarian reserve is going low.
Okay.
And the quality too is going low. So don't say the fact that I saw a woman get pregnant at 45, let me still just be relaxing and relaxing and relaxing, and that's a mistake a lot of people do. When the pregnancy is not coming, instead of seeing a gynecologist, they keep on saying, oh, let's relax. At God's own time, it will come. And before you realize,
Now, are you too late?
it's too late.
Okay.
Yeah.
So, doctor, let me ask you this. A lot of women go through severe menstrual pain. And I want to ask, does it mean that can lead to infertility, or it's just menstrual pain? It has nothing to do with infertility.
All right. So menstrual pain is something we call dysmenorrhea. All right. There are two types. We have what we call a primary dysmenorrhea and a secondary dysmenorrhea.
Okay.
Now, primary dysmenorrhea is normal. How do you know you have primary dysmenorrhea? You feel the pain start with your menses. By last maybe the first 2 days and then stops. And then your menses may go on to like day 5, 4 before it ends. All right. So pain that typically starts with the menses, but just lasts 1 or 2 days and stop. It's primary dysmenorrhea.
Okay.
It's nothing. It's normal.
Okay.
It's just due to things like prostaglandins, which causes your uterus to contract during your menses. But secondary dysmenorrhea is always a problem. Most often, there's an underlying cause. How do you know you have that? The pain may start with your menses and last throughout the whole duration of your menses. You get, or it may even start before your menses and last to the last day of your menses. Most often, there may be a problem. There may be endometriosis. There may be fibroid. There may be PID. There may be some ovarian problem. That is secondary dysmenorrhea. So with that one, you may definitely need to see a gynecologist. So when a woman comes with infertility, these are some of the things we want to find out. The pain during the menses, is it a primary dysmenorrhea? If it's a secondary dysmenorrhea, then we probe further and find out if it's the cause.
Okay. Wow. Whew. All right. Let me ask this. Someone asked me to ask you a special question. All right. So the person had a fibroid surgery, but unfortunately, since then she's not menstruating at all. So what do you think is the problem, and what she can do?
Well, it may be due to so many things. Maybe she's got into menopause,
Oh.
Yeah.
Okay, she's in her 40s. So.
Yeah, she may have got into menopause. In fact, there's something called premature menopause or premature ovarian failure, where women in their 30s or early 40s can even get to menopause.
Okay, she
and
said
it happens.
She went back to check the blood. You could see the blood is there, but it's not coming out.
The blood is okay.
She said they checked the blood, you could whatever, but still nothing is coming out.
Well,
She's getting her signs.
It's difficult to make a conclusion from this, but as I said, it could be due to early menopause,
Okay.
as well. But this person has to see a gynecologist and really be well investigated to find it, because it may the cause of she not having her menses may not necessarily be due to the fact that she had a fibroid surgery.
Okay. So can one just go to the hospital and go and check your eggs, or you don't necessarily need to focus on that?
Oh yeah, you can do it. I mean, that test we do, you can go to the hospital, especially if you are growing older. You are still very much interested in education or career. You are hitting 35 years and you don't have a partner yet.
Yeah.
You may want to go to the hospital, see a gynecologist, check what's going on with your. In fact, I always tell women that you need to see a gynecologist quite often. You don't want to wait to get pregnant before or have a problem. A lot of women, the first time they find out they have fibroid is when they are pregnant.
Oh.
Because then they definitely need to do a scan.
Okay.
And it's because they've not been seeing the gynecologist their whole life, all right? You need to see a gynecologist often. So you can go check, especially when you're hitting 35, you're still more into your career or education, there's no partner. You may want to check, see your ovarian reserve. If you have the means, we have fertility preservation method. You could preserve your
Is
eggs
that
and
the
everything.
freezing the eggs thing?
Exactly. You could do all those things as well.
Okay.
If you have the means to do it.
So what age do you think is the best for women to freeze their eggs?
Yeah, so the most gynecological societies always suggest between the ages of 27 to 34.
Oh.
After 35, we know that your ovarian reserve is declining. The quality too is declining. Okay, we are not saying you can't do it after that.
Okay.
But the optimal time is always before 34.
Right. 34.
Yeah, before 30 up to 34.
Up to 34.
You don't want to wait after 35 to start doing those things because we may not get enough eggs to preserve at that time. You may want to do a number of cycles if you are after 37, 38 as well, and the quality too may not be so good. So the best and optimal age is by 34. If you want to do that, you have the means, then that's the best time to do it.
All right. And these days, a lot of women are having the option of IVF. Some people, they want it, but omakasana, they don't understand. So can you please give us a little idea and knowledge about IVF and how it works?
All right. So IVF is basically what we call in vitro fertilization.
Okay.
Normally, what happens is that when you and your partner have sex, as I said, the sperm gets into the tube. When you ovulate, the eggs also get into the tubes, and that is where fertilization happens. Okay. But there may be a number of reasons why this natural thing cannot happen. Like your tubes may be blocked. The man's sperm will be so low that you may not have enough being able to swim to get there.
Okay.
Very low sperm counts. Or for some strange reason, pregnancy is just not happening. We can't find the cause. So you would want to do IVF. So IVF, what we basically do is that what happens, every woman at the beginning of her cycle, when she starts menstruating from day one, she produces a lot of eggs. Depending on her age, a woman in her 20s may produce like 15 to 20 eggs, okay, which are called antral follicles, small eggs, which would all start growing from the first day of her menses.
Okay.
But by day 5, all of them will die, and only one will grow to maturity and be ovulated. So typically, a woman would ovulate only one egg. That's why human beings will typically give birth to children, one child at a time. But the dog can give birth to 10 or 15.
Yes.
Because with them, all those eggs that would have actually died grow to maturity. But with human beings, by day 5, all the others will die if they are 16, 20 eggs, and only one will grow to maturity. Now, with IVF, what we do is that we would actually stimulate you so that all those eggs that would have died would also grow to maturity. And it's because you're not going to get pregnant naturally, so we are not worried that you end up having 5 pregnancies or 10 pregnancies. So when they grow to maturity, we actually retrieve them, or what we call you may say harvest them, but we retrieve the egg, we take it to theater, and we retrieve the eggs. It's not through an operation. Okay, we do it through the vagina and anesthesia, so it's painless. So we retrieve all those eggs that would have actually died. Okay, so if 20, 60, we take it. Now, just to divert a little, if a woman is above 38, 40, she will not get about 20 or 15 eggs growing. You get it, because her egg reserve is going low. So that's the problem with those ones. So we stimulate you, and we may just get 2 or 1 egg, sometimes nothing at all. Okay, so let me go back. So we retrieve all those eggs, and then we take your partner's sperm, and then we'll do the fertilization in the lab. So the fertilization that would have happened in the tube
is done outside
in the lab.
Okay.
All right. So when the egg and the sperm fertilize, what we get is an embryo.
Oh.
All right. So we keep it in the lab, and then by the 5th day, depending on what protocol is used in the IVF, by the 5th day, we take the woman back to theater and we put some of the embryo back into her womb. All right. So I told you earlier on, when the sperm and the egg fertilize, it stays in the tube for 5 days, and by the 5th day, it falls in the womb and it grows to maturity. So what we do is that what happens here for 5 days, it happens in the IVF lab. And then on the 5th day, we take the one back to the theater and we put the embryo in the womb, because normally, naturally, by the 5th day, to move from here into the womb. So we put it in the womb. and then leave it to grow.
Some people too say that like the IVF, when they do, they get 2 kids, 3 kids.
Yeah, because naturally one egg grows and is fertilized. What happens naturally? But with IVF, most of the time we may put in 2 embryos into the womb.
Okay.
You get it? So if all stays, then you get your twins. Then, and so that's why most of the time these assisted reproductive technologies, people may end up getting twins.
Okay. All right. So let me ask you.
And of course, if you get more embryo because you are younger, we can't put all of them back.
You still have to.
So you
take
freeze
some.
the rest.
Okay.
You can freeze the rest for as many years as you want. You can always go back for it, back in your womb, and then you have another child.
Okay. Before you move on, the men's part. I know most of the time they said the men their sperm is 5 million, 10 million. Can you explain a little bit about that side?
Yeah, so when we do
sperm
semen analysis, we check a number of parameters, all right, among the sperm. It's not just about seeing sperms, you know. Normal sperm counts should be above 36 million by WHO standard.
For a man?
Yeah, for a man. The sperm, when you produce, a normal sperm count should be above 36 million.
How low is low?
Also, I mean, anything below 36 million, we call it oligospermia. It's below the WHO standard. Okay. I mean, of course, when it's very, very low to it, it makes things.
Because I've seen somebody who had 1 million and the doctor almost chewed him up. Like, what is that? Like, it was that bad.
Yeah.
Yeah.
It happens quite often. So we also check the motility. You get it. Over 40% of the sperm should be swimming forward. Because as I said, the sperms have to swim from here all the way up. If they stay long in the vagina, they'll die. Because the vagina is a very hostile place for sperms. It's very acidic. You get it. So the fluid, the semen is basic, alkaline. It's secreted from the prostate gland, so it's alkaline to protect it. So as soon as they enter here, they have to quickly swim and go. If they stay in the vagina, they will die through the acidity. So motility is very important if they are not moving well. And then morphology, to check morphology, that means they have to look good. You know, 1 head, 1 midpiece, 1 tail. Not with 2 heads or 2 tails, or the heads don't look all right. And yeah, they swim, so they need a tail to swim. If you don't have a tail,
like
you can't swim.
or something.
Like tadpoles.
Okay.
Like tadpoles.
Okay, all right.
Otherwise, they can't swim, so they need
the thing. Okay. All right.
Yeah, so we check for all those parameters and the sperms, and all those things have to be good for fertilization to occur.
Okay. So would you advise any woman out there who is struggling with infertility to go in for surrogacy or IVF?
Well, it depends. Surrogacy it's basically letting somebody else carry your child for you. You know, that's what surrogacy is. Yeah. So if you can carry your own child, then you don't need to go for surrogacy. But if you have a medical condition, you know, which prevents you from carrying a pregnancy, there's some medical conditions which you can't carry a pregnancy till term. You know, it'll be very high, uncontrolled hypertension, uncontrolled diabetes. Maybe you've had a surgery, they've removed your womb, you know, so you don't have a womb, but your eggs are there. You know, so there are reasons why maybe you can't, medical reasons, and then you can do surrogacy. So they are very different things, okay? IVF doesn't mean it has to be surrogacy. So surrogacy is if for some reasons you can't carry your own child, some of which I've mentioned, that is when you consider go for surrogacy.
Okay.
Yeah.
All right. So is there any supplements or stuffs men and women having infertility problems can take? Or you just advise them to just go to the hospital?
Oh, okay. So as I said, when you have fertility issues, you first need to see a gynecologist to find out the cause. Of course, if your tubes are blocked and you are taking supplements, nothing will happen. Or, do you get it? So, of course, make sure that you always, as a woman, you are naturally on folic acid, because folic acid is very good. It prevents neural tube defects in children, in the babies when you're pregnant. Things like coenzyme Q10. I mean, so there are a lot of supplements in the market. Just make sure that, I can't mention particular brands, but just make sure what you're buying has certain things like coenzyme Q10, which is very good.
Yeah.
It has things like zinc. Zinc also helps with sperm mobility. Vitamin E, vitamin C are very good antioxidants, because oxidative stress has a lot of effect on the sperms and on the eggs. So vitamin E, vitamin C are very good antioxidants. Omega oils are also very good, right? So make sure that at least whatever supplements you are buying, they contain these things as well to help.
All right. Now let me ask you, this particular topic I personally did a whole episode about this thing 2 years ago. That is where we are here now, because a lot of people were entering me and DM for questions, but I didn't have answers to that. Now, I want to ask, some people were saying, oh, maybe the sexual positions is the reason why you guys are not having a kid. Do you think it matters? Or if it does, what is some specific positions that anybody looking for a child can do?
Well, no studies has clearly showed that a particular sexual position is better. There are always rumors, oh, this position will give me a boy, this position will give me a girl, this position. No studies is conclusive that this particular position
can help.
Help. You know, some say that, okay, positions where gravity helps, like a missionary position,
yes, I've heard
or
that.
doggy position helps with gravity, you know, so the gravity helps keep the sperms deep in the cervix to go through. But as I said, no particular studies have showed. The important thing is, if you are trying to get pregnant, make sure you're having sex at least 3 to 4 times a week. You know, make sure you have couples that they want to get pregnant, but they are not having sex.
They are not having the pregnancy.
So, that's the most important thing. Not really about the position, but the fact that you're having sex regularly. So there are always sperms inside the reproductive system, because the sperms typically can last up to 4 to 5 days in the woman. You know, that increases the chances of getting pregnant.
Okay, so I would like you to advise any couple out there who is trying to conceive, some solid advice for them.
Yeah, so if you are trying to get pregnant, remember, so far as you've been trying for more than a year and it's not coming, and you're a lady less than 30, if your lady is less than 35 years, it's time to see a gynecologist. Don't keep on saying, oh, it will come, let's keep on praying. See your gynecologist. If you are more than 35 years as a woman, 6 months and you're not getting pregnant, make sure you see your gynecologist. All right, very, very important. Do not keep on waiting and waiting and waiting. This is very, very important, because that's a mistake a lot of people do. Now, even though I've given time limit, 1 year or 6 months, if you are having certain problems, you don't have to wait. Like the woman, your menses is irregular. All right, 2 months, 3 months, your menses is not coming. 6 months, see your gynecologist immediately. Most likely you're having some hormonal problem. You are not ovulating. All right. If the man, you're having erectile dysfunction, you know, you're not able to have an erection, you don't have to keep on waiting and struggling. See a doctor as soon as possible. All right. So these are some of the things, the important things I can advise you on. And of course, have regular sex. A lot of couples are not having regular sex who are trying to get pregnant. Sometimes it's not easy because the man is working in Accra, the woman is working in Ho. It makes things difficult sometimes. In this case, also see a gynecologist, work with him, help him, let him help you know your fertile window, and so that you plan when best you have to travel to see your partner as well. Most of it, we don't like timed intercourse where we say have sex. It puts a lot of pressure, especially sometimes on the man, you know, performance anxiety, the erection will not even come. You know, but in certain cases where because of work, education, you are living apart, there are times that a gynecologist can help you when best to visit each other to get pregnant. And so remember, infertility always has a solution. You know, there is always a solution, from basic teaching of the gynecologist, giving you certain medication, all the way to the extreme IVF. There's always, and then even adoption. There's always a solution. So definitely don't give up.
Okay, let me ask you one last one before we sign out. A lot of women who are these days career and stuff, so they would love to have what's the name, contraceptive. Yeah, but there are different types. So which one would you recommend for women?
Yeah, so you can't just recommend a contraceptive for a woman. When you need to have a contraceptive, you see a healthcare provider. We take you through something called medical eligibility, all right, to see which one you are more eligible for, all right, and then we counsel you for you to make your own decision. All right,
Oh.
you make your own. It will give you all the contraceptive method and the pros and cons. All right.
Because some of them are gaining weight and things.
Yeah, because a lot of people start contraceptive and they don't get good counseling. They don't know which one is good. They don't know the benefits, the undesirable. I wouldn't say complicated, undesirable effect. You know, that's some contraceptive you may use, and you may not have your menses for months.
Yeah.
All right. It's because of the contraceptive, but the women get alarmed because they didn't get proper counseling and they think the contraceptive is not good, but it's normal. Some may be having spotting from time to time, which they don't like, and because of that they may not even use contraceptive at all again. But these are all things that there are solutions to, and when you are made aware before you start it, you expect it. So when it happens, you are not alarmed. All right. But the problem is most people just walk to a pharmacy or just start a contraceptive without seeing the proper healthcare provider to really educate and see which one they are medically eligible to. There are certain contraceptive, if you are obese, we may not want to put you in because we may have certain complication. Or if you have a certain illnesses, we may not want to put you in. And you may go and start it without knowing. All right. So it's always best to see a healthcare provider where they can talk to you about contraceptive, all the types, the pros and cons of each, and then they help you to make your own informed choice on which one best to use.
So, doctor, there is a lot of pregnant women who are kind of stuck on Shide, Ayolo, that thing. And I would like you to advise them. Is it just craving or it can actually cause problem for them?
Yeah, so this is something we call Pica. All right, and some women, it happens to certain women, and it's not ideal. We don't encourage it. You know, this clay thing can have certain chemicals or toxins in, like arsenic or lead in it, which you are consuming whilst you are pregnant, which may not also be good. All right, also consuming large quantities could actually cause intestinal obstruction because it's just clay, which could go there and get hard and cause intestinal obstruction. And also studies have shown that this clay too sometimes can bind to iron. All right, and prevent iron absorption, which your body needs, you know, as a woman who is pregnant, to increase your blood level. So these things are not ideal. We discourage it totally. You are getting actually no nutritional benefit from, which pregnant women should try as much as possible
to stay away
from because of these things. You don't want anything that will harm
you and your baby.
Yeah.
Woo. All right. This one there. Today I'm coming to collect money from everybody because I've asked all your questions. Yes. And I'm happy we had the right person in the studio to do this for us. Thank you, doctor, for being here with us. I hope we will see you again someday. If we invite you, you come.
No problem.
All right. So before we sign out, please, if we want to find you, the listeners and stuff, where can they find you, how to locate you, contact you?
Oh, okay. So I'm a medical director of Pica's Medical Center in Accra. I like giving education to women too a lot. So you can always find me on TikTok. Just type in Dr. Pakalote, you see me, and you can learn a lot from what I teach. Okay, yeah.
Okay, your medical center, where is it located?
It's near the West Hills Mall, at the Awaja.
Okay.
That's where we are located.
Is there any number they can call just in case?
Yeah, 024 622 9903. 024 622 9903.
All right. Okay, guys. Thank you, and thank you to our special guest in the building. Thank you so much. So I know this is me. If I needed this, and a lot of women in my DM, their answers are being given today. So thank you for being our guest today. All right, guys. I know you love today's episode. Please, I know there's somebody in your family or your friend or something who needs to watch this episode. Okay, all right. I love you guys so much. Please make sure you share, you comment, you leave your thoughts in the comment section, you subscribe, whatever it is. Let's just push this particular episode because a lot of people need to see and learn. All right. I love you guys so much. My name is Genevieve. See you again in the next episode. Bye bye.
Charlie, we bring you the best. I'ma forget the rest too. Always and always, we treat some good topics like money. managing relationships and marriage, making money, empowering the women, traveling motivations. Hey, managing relationships and marriages, making money, empowering the women, traveling motivations. Hey, follow us on Facebook, follow us on IG, Twitter, TikTok, Twitter, YouTube, everywhere. Follow us on Facebook, follow us on IG, Twitter, YouTube, everywhere. Yeah. Tales and Virtues Podcast.